Welcome back to Fox 10 News at 4. I'm sitting down with Dr. Rachel Larry and Dr. Chris Whitman with Infirmary Health, and they are here to discuss ways what you may or may not know about antibiotics, what they treat, and how we can actually build a resistance to antibiotics. Guys, thank you for joining us.
Thank you.
Thank you.
All right, so we're going to get into this. What is Antimicrobial Stewardship Program?
So first, antibiotics are drugs that target bacteria, fungus, parasites, and viruses. So an antimicrobial stewardship program is primarily in the hospital, and it's led by infectious disease trained pharmacists and infectious disease trained physicians. Our goal is for all patients that are on antibiotics to receive safe and effective therapy and to prevent antimicrobial resistance.
Okay, and then also U.S. Antibiotic Awareness Week, that is coming up in a few days. What is that exactly?
Yeah, so U.S. Antibiotic Awareness Week is an annual observance that's led by the CDC, and the point of it is really to raise awareness of this threat of antibiotic resistance that we're seeing, and also recognize the importance that appropriate antibiotic use plays in helping slow and prevent that.
And then speaking about that, why is antimicrobial resistance a concern in our communities today?
Yeah. So antimicrobial resistance is one of the largest global health threats that we face today. Common infections such as skin soft tissue infections, urinary tract infections, if we don't have effective antibiotics, within 3 days they can become life-threatening.
Oh, wow. All right, and then what can we do to prevent antibiotic resistance?
Yeah, antibiotics are a very valuable resource, but it is a limited resource that should only be used when it's needed. So one of the main contributors to resistance is the overuse of these drugs. There's been so much new information that's come out even in just the last 5 to 10 years about how to most optimally use antibiotics and how to prevent that resistance and really what we know about it. So a part of our job is making sure the clinicians within our community and our health system are keeping up with that evidence and staying up to date on how to best prescribe them. So a lot of times that includes things like not prescribing them when they're not needed or not prescribing them for excessively long durations. For our community members, they play a role as well. So one of the main things we recommend is just being aware of common situations where antibiotics are actually more likely to cause more harm than good. So thinking of things like the common cold or other viruses that are commonly circulating in the community, in those situations, antibiotics are not going to provide any benefit. Another example of a situation we see a lot of times would be if you're told you have bacteria in your urine. Historically, patients hear that and they immediately think, oh, I need antibiotics. But remember, we have bacteria that are normally living on our skin and in our gut that actually play a beneficial and important role in our overall health. So keep that in mind, take antibiotics as prescribed, and don't take antibiotics when you feel bad that are laying around your house. That may not be the right thing for you at that time, and it may actually cause some harm.
All right. Well, thank you, Dr. Larry, Dr. Whitman, for stopping by and letting us know more information on that.